Why is it important for a CNA to understand a patient's cultural background? A. To change the patient's beliefs. B. To provide culturally competent care. C. To promote hospital policy only. D. To encourage religious conversion. Answer: B. Understanding cultural background helps CNAs provide respectful and individualized care, promoting better outcomes. A resident refuses a meal because it conflicts with their religious fasting. What should the CNA do? A. Insist the resident eat. B. Report and document the refusal respectfully. C. Offer another meal anyway. D. Ignore the refusal. Answer: B. The CNA must respect religious practices and inform the nurse while documenting the refusal accurately. Which of the following best demonstrates cultural sensitivity? A. Using slang to build trust. B. Assuming all residents celebrate holidays. C. Asking about the patient's preferred customs. D. Ignoring differences for equal treatment. Answer: C. Asking patients about their customs shows respect and ensures their needs are met appropriately. What should a CNA do if a resident wants a spiritual advisor present before surgery? A. Say it's not allowed. B. Tell them it's unnecessary. C. Notify the nurse so arrangements can be made. D. Recommend a different advisor. Answer: C. The CNA should support the resident's spiritual needs by notifying the nurse to coordinate the request. Which action violates a resident's cultural rights? A. Speaking slowly for clarity. B. Forcing participation in religious services. C. Providing a choice in meals. D. Allowing religious visitors. Answer: B. Forcing religious participation is disrespectful and a violation of the resident's rights. A resident uses prayer beads during care. What should the CNA do? A. Take them away temporarily. B. Ignore them during care. C. Allow their use unless they interfere with safety. D. Replace them with a watch. Answer: C. The CNA should support spiritual practices when they do not interfere with safety or care procedures. A resident from another culture avoids eye contact. What should the CNA assume? A. The resident is guilty. B. The resident is being disrespectful. C. It's a sign of cultural respect. D. The resident is confused. Answer: C. In some cultures, avoiding eye contact shows respect. CNAs must not misinterpret this behavior. If a resident asks for time to pray during care, what is the CNA's best response? A. Deny the request to stay on schedule. B. Allow time if it doesn't interfere with medical needs. C. Tell them to pray after care. D. Ignore the request. Answer: B. CNAs must balance respecting spiritual needs with delivering timely care when safe to do so. Which is an example of spiritual distress? A. Requesting a chaplain. B. Crying without explanation. C. Expressing guilt over illness. D. Refusing meals for religious reasons. Answer: C. Expressing guilt or confusion about suffering may indicate spiritual distress requiring support. What should a CNA do if unsure how to assist with a resident's cultural practice? A. Ignore the practice. B. Ask the charge nurse or resident. C. Tell them it's not allowed. D. Make a guess. Answer: B. When unsure, CNAs should respectfully ask for guidance to avoid offending the resident. A resident listens to spiritual music for comfort. What is the CNA's responsibility? A. Turn off the music. B. Discourage music during the day. C. Allow it if it doesn't disturb others. D. Change it to something neutral. Answer: C. The CNA should respect the resident's spiritual expression as long as it does not interfere with others. Why is cultural competence important in long-term care? A. It helps avoid lawsuits. B. It ensures faster care. C. It enhances trust and quality care. D. It replaces medical training. Answer: C. Culturally competent care improves communication, trust, and satisfaction for residents. A resident only eats kosher food. What must the CNA do? A. Offer regular meals. B. Inform dietary services and respect the request. C. Encourage them to try non-kosher options. D. Assume it's a temporary preference. Answer: B. Religious dietary needs must be communicated and respected in all care settings. What should a CNA avoid when discussing personal beliefs with residents? A. Listening respectfully. B. Sharing spiritual experiences. C. Pressuring residents to agree. D. Encouraging chaplain visits. Answer: C. CNAs must never impose their own beliefs on residents. Their role is to support the residents' preferences. Which culture-related factor may influence how a patient perceives pain? A. Eye color. B. Language alone. C. Cultural background and beliefs. D. Room temperature. Answer: C. Culture affects how individuals perceive, express, and manage pain. What is the CNA's best action when a resident declines care due to a cultural belief? A. Report the refusal and respect the decision. B. Provide care anyway. C. Document without informing anyone. D. Argue with the resident. Answer: A. Respect and communication are key. The CNA must document and report any care refusal. If a dying resident wants to speak to a spiritual leader, what should the CNA do? A. Tell them it's not possible. B. Suggest a different activity. C. Notify the nurse immediately. D. Ask why they want that. Answer: C. The CNA should act promptly to support the resident's spiritual needs during end-of-life care. Cultural humility involves: A. Assuming all residents want the same care. B. Recognizing and respecting cultural differences. C. Correcting a resident's beliefs. D. Avoiding cultural topics. Answer: B. Cultural humility means acknowledging one's own limitations and honoring others' beliefs. Which term describes recognizing and honoring others' cultural needs? A. Cultural bias. B. Cultural competence. C. Cultural conflict. D. Cultural ignorance. Answer: B. Cultural competence is the ability to provide respectful care across diverse backgrounds. What might a CNA observe in a resident practicing daily spiritual rituals? A. Refusal to bathe. B. Regular prayer or meditation. C. Aggression. D. Excessive sleeping. Answer: B. Some residents follow daily rituals for spiritual purposes. CNAs should allow them when appropriate. A resident wears a religious head covering. The CNA should: A. Ask them to remove it for convenience. B. Respect and work around it. C. Replace it with a hospital cap. D. Wash it without permission. Answer: B. Respect for religious attire is essential unless it interferes with medical care. During care, a resident starts chanting a prayer. The CNA should A. Interrupt them to finish quickly. B. Allow them a moment if safe. C. Tell them it's not the place. D. Leave the room permanently. Answer B. If the situation is safe, the CNA should respect the resident's prayer time. Which of the following is a respectful way to learn about a resident's culture? A. Asking in a judgmental tone. B. Assuming based on appearance. C. Asking open and sincere questions. D. Avoiding conversation. Answer C. Respectful, open-ended questions help the CNA understand cultural needs. Why must CNAs avoid stereotyping? A. It helps efficiency. B. It creates humor. C. It leads to unfair and disrespectful care. D. It's part of cultural competence. Answer C. Stereotyping can damage trust and result in poor quality care. What should the CNA do if a resident's family wants to perform a cultural ritual? A. Deny access to the room. B. Allow it with nurse approval. C. Discourage the ritual. D. Suggest a different time. Answer B. Cultural rituals should be supported if approved by the nurse and do not interfere with care. If a CNA doesn't understand a resident's belief, they should A. Ignore it. B. Ask respectful questions or consult the nurse. C. Try to change it. D. Avoid the resident. Answer B. Learning respectfully is key to providing appropriate care. A resident believes in alternative healing. What's the CNA's role? A. Convince them it's fake. B. Support beliefs unless they interfere with treatment. C. Report them as non-compliant. D. Provide the healing themselves. Answer B. CNAs should support beliefs while ensuring the care plan is followed. What is one way CNAs can show respect for different religions? A. Celebrating only their own. B. Attending all services. C. Supporting residents' participation in their choice of worship. D. Asking everyone to be non-religious. Answer C. Residents have the right to practice their faith and CNAs should support that. A resident is uncomfortable being touched by the opposite gender. What should the CNA do? A. Ignore the concern. B. Force the care anyway. C. Request a staff member of the same gender. D. Make a joke about it. Answer C. Respecting personal and cultural boundaries includes gender-based preferences. CNAs can promote spiritual wellness by A. Enforcing spiritual views. B. Avoiding spiritual topics. C. Encouraging participation in meaningful practices. D. Dismissing requests as unnecessary. Answer C. Supporting spiritual needs enhances emotional well-being and overall health.